Today topic of discussion is phenylketonuria, PKU. This one comes under inborn error metabolism of phenylalanine. If there is mousy odor of urine, the case will be phenylketonuria. If that urine turned black color, the case is alkapturia. So, mousy odor, phenylketonuria. The patient infected from phenylketonuria. Now, what is PKU? Phenylketonuria. It is due to defect of enzyme phenylalanine hydroxylase. What is the enzyme name? Phenylalanine hydroxylase. It is a autosomal recessive disorders. It is most common and incidence is 1 in 10,000 birth. So what is PKU? Defect in phenylalanine hydroxylase enzyme, autosomal recessive disorder, then most common and incidence in 1 in 10,000 birth. The reaction, this is important reaction catalyzed by phenylalanine hydroxylase. That enzyme name is called phenylalanine hydroxylase, in which phenylalanine is converted into para-hydroxyphenylalanine, that is tyrosine. One molecule of oxygen is incorporated its para position. This reaction tetrahydrobiopterin depended. Due to the lack of this phenylalanine hydroxylase, this reaction is known as phenylketonuria. There are types of phenylketonuria. There are 5 important types. Type 1, classical example, phenylketonuria. This one is defect in phenylalanine hydroxylase enzyme. Type 2 and 3, defect in dihydrobiopterin reductase. Type 4 and 5, defect in dihydrobiopterin biosynthesis. So, due to lacked in phenylalanine hydroxylase reaction, this phenylalanine is diverted to another pathway. So another pathway and gives phenylpyruvate. It will give phenylpyruvate. It is a keto acid. That's why it have that name phenylketonuria. So black of this phenylalanine hydroxylase, this phenylalanine is converted into phenylpyruvate. This phenylpyruvate is a keto acid. That's why it have that name phenylalanine ketonuria. Then this phenylpyruvate is converted into phenyl acetate and phenyl acetyl glutamine. These two component gives mousy odor to urine. So these two keto acid, phenyl acetate and phenyl acetyl glutamine, these two keto acid is producing mousy odor to urine. Next, clinical manifestation. There are 2 important clinical manifestation, that is effect on CNS and effect on pigmentation. This effect on CNS, this one mainly mental retardations, failure to walk and talk, then growth failure. This one effect on pigmentation, this one hypopigmentation. So light skin color, fair hair and blue eyes, etc. So blue eye causes of phenylketonuria. Diagnosis of phenylketonuria. Screening for prenatal diagnosis by DNA probes. The screening of neonates by Go3 test. Then ferrichloride test, chromatography, thin layer chromatography and vapor chromatography. The confirmatory test done by tantum mass spectrometry. Tantum mass spectrometry. So prenatal diagnosis, DNA proof, Go3 test, ferrichloride test, chromatography and tandem mass spectrometry we can use to diagnose. So now discuss about Go3 test. Phenylketonuria is an inborn error metabolism characterized by high level of amino acid, that is phenylalanine. So this one is the inborn error metabolism. Phenylketonuria is diagnosed by means of Go3 test. Knee prick sample is collected. That sample is allowed to filter paper. Filter paper is allowed to dry. This filter paper put on the agar plate. They contain growth of Bacillus subtilis. This Bacillus subtilis will use the phenylalanine presence in the blood, and the growth in the agar plate and the diameter of the disc is directly proportional to the concentration of phenylalanine in the blood. This one is screening test for phenylketonuria. So here we collected samples from knee prick samples collected, then samples allowed to filter paper, that filter paper allowed to dry, then put on that agar plate, that agar plate containing Bacillus subtilis. This one will use phenylalanine presence in the blood, and the growth of agar plate, the diameter of the disc is directly proportional to the concentration of phenylalanine in the blood. This one is screening for phenylketonuria. Then treatment. Limit phenylalanine intake. Then tyrosine should be given in diet. Then avoid high protein food like meat, fish and egg. Statement form. Thanks for watching.